Hey everyone, this is Victor Abafe with A Healthier Democracy. And today I want to talk about Kanuszewski versus the Michigan Department of Health and Human Services, a case that was recently decided in the Sixth Circuit Court of Appeals. This case centers on the Michigan Newborn Screening Program, a public health initiative that began in 1965 to test infants for over 50 rare diseases using a simple heel prick when they're born. Every year, more than 250 babies are diagnosed early with treatable conditions because of this program. After screening, though, these blood spots that are taken from these babies are stored without personal identifiers by the Michigan Neonatal Biobank, supporting research, test validation, and sometimes victim identification in criminal cases. For 4 parents and 9 children who were subject to these tests, challenged this practice, arguing that collecting and indefinitely storing blood spots without explicit consent is coercive and violates constitutional rights. They claimed this process infringed on children's Fourth Amendment protections against unreasonable searches and seizures, as well as 14th Amendment rights regarding parents' liberty to direct their children's healthcare. It's a substantive due process right. Initially, a federal district court sided with the families, ruling for them on both constitutional grounds. But on appeal, the Sixth Circuit disagreed. The judges found that the storage and research use of anonymized blood spots don't equate to medical care, and they don't restrict a parent's control over their child's treatment. In their view, these practices didn't intrude on fundamental parental liberties under the 14th Amendment, nor did they trigger Fourth Amendment protections, since anonymized research doesn't reveal personal information about the children involved. The court's decision upholds the legal foundation for population-wide newborn screening, an important tool that supports timely interventions and robust scientific research. The ruling also signals that state health departments can ethically use anonymized biospecimens for non-clinical research after newborn screening is complete, balancing privacy protections with public health benefits. As we weigh the best ways to protect public health and privacy, it's critical to ensure that laws both support individual rights and research that lead to healthier communities. Kanuszewski versus Michigan reminds us that public trust and greater public good are both important if we're trying to build a healthier democracy.